Good morning, everybody. Welcome to the Staff the Front Lines press conference. My name is Steve Tully. I'm the Executive Director of AFSCME New Jersey Council 63. AFSCME stands for the American Federation of State, County, and Municipal Employees. Council 63 represents nearly 3,000 members throughout Jersey City and Hudson County. Our members are public service workers who live and work in Hudson County, providing services that are an integral part of the quality of life here in the county, including healthcare, social services, emergency services, educational resources in our libraries. Our members help give a quality educational experience for our children, and there are so many other essential services that the people of this community rely on that our members provide. During COVID, it was our members and all public service workers who were on the front lines and who led the way in helping our communities through a once-in-a-lifetime pandemic. Oddly enough, while these everyday heroes performed remarkably through the pandemic, the number of public service workers has dropped dramatically. In fact, right now there are hundreds of open positions in public service right here in Hudson County alone. Now, this is not a problem that is unique to Jersey City or Hudson County. It's a problem that affects us all across New Jersey, and in fact, it's a problem throughout our entire country. It's why our union, AFSCME, the largest public service worker union in America, is working hard to recruit public service workers all across this country. It's why we're here today, to raise awareness about these public service jobs and to staff the front lines. Our economy is in the midst of a strong recovery, especially in the private sector. And now is the time to focus on filling these public service jobs so that we can continue to provide essential services to the people of Jersey City, Hudson County, and all over New Jersey. It's why we're partnering with great leaders at the local and county level, like Jersey City Mayor Steve Fulop and soon-to-be County Executive Craig Guy, working together to recruit people to work in public service. That's particularly important in underrepresented communities and communities of color, where public service jobs can provide economic stability and be a path to the middle class. These are good union jobs we're talking about, with good pay and great health benefits and pensions and job security. The people of this community can make a difference, and they can get paid while doing it. And with that, it is my honor to introduce to you the Secretary-Treasurer of our great union, AFSCME, Alyssa McBride.
Good morning. I'm going to start with a number, 970,000. That's more than the population of Newark, Jersey City, Trenton, Elizabeth, and Patterson combined. And it's also the number of public sector job vacancies in the United States right now. And that's why we are here to staff the front lines. We've got to find talented, passionate, qualified people to apply for these good, secure, and impactful jobs in healthcare and the public service. So at every stop on this national bus tour, we're talking about the importance of recruiting and retaining a new generation of public service and healthcare workers. We're lifting up the fact that these union jobs come with strong rights and protections and opportunities for advancement. We're shining a light on the opportunity to do work that has meaning and that makes us part of something bigger. And we're fighting for fair wages and benefits and educational opportunities so workers join not for a season or a stint, but for a lifetime in public service. Jobs in healthcare and public service are unique opportunities to make a difference in the lives of our neighbors and to make a decent living and have excellent benefits. And AFSCME members who are part of that work are shouldering a heavy load right now because we've carried our communities through the pandemic And now we're carrying our communities through the staffing crisis. But these hardworking healthcare and public service workers refuse to give up because they were called to the work that they do. And they know that a union job means stability and a voice at work, and that matters to us.
That's right, yes.
But every day that these positions remain unfilled, our communities struggle. Our loved ones in hospitals wait longer because nurses and nursing assistants have too many patients. Those with mental health and behavioral health challenges wait too long to see a therapist. More people are needed on the front lines to provide these essential services. So we're pleased to partner with these elected officials who understand this crisis and are committed to finding solutions. We had an incredibly powerful listening session here this morning where we heard from a library worker, a certified nursing assistant, a county welfare administrator, a patient care tech, all of them passionate about healthcare and public service. And we were joined by elected officials, faith and community leaders, and the president of a leading safety net hospital to talk about solutions. These conversations and this collaboration are critical to success. Our next stop in our Staff to Frontlines tour is Philadelphia, then we're on to Harrisburg, Pennsylvania. We've been from Rochester, New York, to Minneapolis, to Albuquerque, coast to coast. We are rebuilding public services, state by state, city by city, county by county, workplace by workplace. We have a clear message. Join us in healthcare and the public service so every community can thrive. It is time to staff the front lines. And with that, I'm going to bring up Sue Cleary, who is the president of AFSCME and District 1199J, New Jersey. Sue.
Good morning. My name is Sue Cleary, and I'm proud to serve as president of District 1199J, National Union of Hospital and Healthcare Employees, AFSCME. As those before me have covered, we're here to raise awareness about the importance of filling public service jobs. Today, I want to bring special attention to the dire need we have in healthcare. The members of District 1199J are the frontline heroes who worked nonstop during the pandemic to save lives and keep our communities healthy. They worked in our hospitals, nursing homes, and other facilities to ensure our loved ones received quality care. Although the threat of COVID-19 is alleviated, the truth is we are still dealing with its impact in our workplaces. We lost more than 40 members, our friends, who gave their lives fighting to save others. We understand that many people have been hesitant to enter healthcare since they saw that our jobs are tough. But working in healthcare is also the most rewarding job you can have. Whether you're a nurse, nursing assistant, housekeeper, dietary aide, you are an invaluable part of keeping our communities healthy. We need more courageous and compassionate people who are ready to step up and join this essential workforce. Here in New Jersey, there are many good union jobs in healthcare with fair pay, great benefits, retirement, and job security. You can make a difference and earn a living that allows you to take care of your family. Your first job in healthcare is only the beginning. There are many opportunities to move up the ladder, continue your education with support, and build a career. If you're worried about how to afford the education required, know that there are investments being made to help students and training programs available. 1199J is proud to have our own Youth Transitions to Work Training Fund, where we help high school juniors and seniors get trained and certified to become certified nursing assistants and physical therapy aides. We have also a program for adults. Both programs have a 100% job placement record. The truth is we need more investments in this workforce, and that's why we've started a new task force to figure out how we can continue to improve recruitment and retention. So if you've considered a future in healthcare, I'm here today to ask you to answer that call. There's never been a better time to join this profession. Employers are actively hiring. Your community needs you, and the healthcare workers who are still on the front lines need you too. Apply today. Now it is my distinct pleasure to introduce the Mayor of Jersey City, Stephen Fulop.
Thank you. I just want to echo the sentiments from Alyssa and Steve Tully and Sue, of course, that this is one of the most important things we could be doing today, educating the public around what type of job opportunities there are and trying to fill gaps with regards to what we can do better as an employer to entice people to want to come into frontline workers and be a profession that is meaningful, long-term, with great benefits in healthcare and the importance of the jobs that they do. I want to say thank you to everybody also who participated in the roundtable earlier today. It was really good to share some of the concerns and to hear from, not necessarily the same side of the table with regards to what we should be doing better, what the challenges are for employees, and where we can work together to collaborate on fixing the process, for example, in civil service down in Trenton. We share a lot of the same goals here, if not all of the same goals, to make sure that we have the best services delivered for our residents, and that starts with having good people that are motivated and feel good about their jobs. And that's why this is important, so thank you all for coming out today. Really appreciate it.
Good morning, everybody. Thank you, Mayor Fulop, and thank you to Mayor Fulop and Alyssa and Steve and Sue for hosting this event. Like Mayor Fulop said, we had a round table this morning and we heard from the different side of the table. And, that's where the meat and potatoes are in how much we can serve the community. I look around here, talk about the front lines. I'm retired from the Jersey City Police Department. This is where I started my career, my first career. And this is where I'm embarking onto my second career. And I like to look at this area as a renaissance. And I think and I hope that this roundtable and this awareness campaign that AFSCME is taking part in is going to raise the awareness for the frontline workers, raise the awareness of the people that need to work for fair wages, good working conditions. I'm committed to AFSCME. I'm a union guy first before I'm a potential elected official. So I know how it is to work in conditions that aren't the best. I know how it is to start working at a wage that's not really going to be able to feed your family, put your kids in school. So, my commitment is solid. Steve and company and Alyssa, you have a friend in Craig Guy as we move forward. So many of those things that we heard around the round table today, I'll put into motion with my own plan as I move forward in the transition. So thank you for having me. Thank you, Mayor Fulop, for hosting this great event. And with that, I'd like to introduce the President and Secretary Treasurer of 1199J, Craig Ford.
Well, first of all, thank everybody for being here to staff the front lines. My name is Craig Ford. I'm the National President of the National Union of Hospital and Healthcare Employees, and I'm also the Secretary Treasurer for District 1199J. NUCHI, as we know ourselves to be called, we represent healthcare workers across the country. We represent healthcare workers in the private sector and as well as the public sector. We have nurses, doctors, food service workers, dietitians, and therapists. Like President Cleary said earlier today, we have such an opportunity to staff the front line, especially here in healthcare. And today I would like to join with us Dr. Bullock. He's the CEO and the president of CarePoint. Join me.
Thank you very much for having us. AFSCME 1199J, we thank you. Frontline workers, as aptly named, after the soldiers in this country who actually face enemies that you can see, they faced enemies that were unseen and unheard, and they fought just like our soldiers. So we thank you for that. CarePoint Health is a large safety net hospital. We are the #1 provider of healthcare in Hudson County. We are facing the same issues like anyone else in the country with inability to hire enough people to take care of our patients. The patients that come to our hospitals are largely uninsured and underinsured, and they have the largest amount of pathology and not very well. So the burden on the frontline workers is immense. So what are we done? What are we doing to make these things better for our frontline workers? We're trying very hard to get them an environment that is conducive to work. For that, we have opened up lounges for our nurses, which got opened up to the CNAs just 10 minutes back. We have lounges for our physicians and frontline workers. Being a frontline worker myself, I really understand the issues that you all face. The problem is that the large amount of money that is being spent nowadays in salaries is not really going to frontline workers. So the policies that the state and the central government and CMS should follow, that a proportionate amount of money should be given uniformly to the frontline workers because they serve us the most. The other thing that we have really done is we are the only system in the entire nation that has opened a hotline for frontline workers called MindLine. So any frontline worker can look at our website, it's called MindLine, and can call in anonymously and talk about your issues and your problems. And we have a therapist and psychiatrist and behavioral health specialist free of cost answering your calls and helping you all out. So this is a way in which we are giving back to our frontline workers. We encourage them to come back. We will support you as you support us. Thank you very much.
Thank you everyone for coming out today. That concludes our AFSCME Staff the Front Lines press conference here in Jersey City. You can go to staffthefrontlines.org to learn more. And if reporters have any other questions, my name is Nick. You can come to me and I'm happy to facilitate interviews or anything you need. Thank you so much, and let's staff the front lines. All right. Well, everybody's up here. Can I get a video of everybody saying staff the front lines? All right, everybody. 1, 2, 3.
Staff the front lines!
Let's do it one more time. 1, 2, 3.
Staff the front lines!
All right, thank you guys. Thank you so much.
It's always good to see you. And it's good to see you all not on camera.
That's right, good person. That's right. That's right.
We don't need that.
We have to have our meeting online again.